We dive in, a quick note on data integrity. The patient information and clinical metrics shown in application are for demonstration purposes only. We prioritize security above all else, ensuring that real-world deployment adheres to the highest global data protection standards. You arrive at the AssemblyHealth login screen and observe the healthcare platform's welcome message and core security features. You explore the landing page, which highlights the AI-powered care system and the various secure health record features available to users. You scroll through the platform features, reviewing the AI concierge, smart scheduler, secure locker, and HD televisit capabilities before checking the security certifications and compliance standards to ensure the system meets HIPAA and SOC 2 requirements. You review the platform's core offerings, such as the AI concierge for symptom analysis and the smart scheduler for easy appointment booking. You click the Get Started button and select the I'm a Provider option to begin the registration process for healthcare professionals. You fill in your personal details, including your first name, last name, email address, and a strong password to create your account. You enter your professional credentials, including NPI and license numbers, select your specialty as pediatrics, and input your medical school and clinic details, including the clinic address and your graduation year to complete the second step. You upload your medical license document, select the document type from the drop-down menu, and submit your complete application for credentialing review. You return to the main login page and sign in with your newly created provider credentials to access the Healthcare Management Hub. You access the Provider Hub to track your credentialing status and review the documents you've submitted for the verification process. You switch to the Admin Console to oversee system health, active alerts, and manage user accounts and roles across the entire platform. You navigate to the Provider Applications list and select a pending application to review the provider's credentials and uploaded documents. You approve the provider application, adding a note of confirmation before finalizing the credentialing process for the new healthcare user. You see the updated status in the Provider Hub, confirming that your credentialing has been approved and your account is now active. You land on the Provider Dashboard, where you can view your daily schedule, patient queue, and pending actions at a glance. You return to the Admin Console's User Management section to manage roles and account statuses for various users in the system. You check the HIPAA audit log to monitor system activities, ensuring all actions are tracked for security and compliance purposes. You access the admin settings to manage profile information, account security, and session data for the administrative account. You navigate back to the main website and click Get Started to begin the patient registration process. You fill out the patient registration form, entering your first and last name, email address, and selecting your date of birth from the calendar before setting a secure password to protect your health data and completing the sign-up to access the patient portal. You log into the patient portal using your new account details to access your health dashboard and manage care. You navigate to the Appointments section, search for a provider, and select Dr. Joseph. After choosing a convenient time slot, you confirm the appointment details and upload a photo of your insurance card to the secure locker for the provider to review before the visit, and then navigate back to your dashboard to see your confirmed schedule. You switch back to the provider view and check the patient queue to see who is waiting for their appointment today. You open the Patient 360 view to review the patient's medical history, visit timeline, and prepare for the upcoming consultation. You use the quick actions to write and send prescriptions for amoxicillin and atorvastatin, specifying dosage and refills for the patient to ensure they receive the correct medication from their pharmacy. You order a set of lab tests, including a CMP and urinalysis, and send the order directly to the patient's portal. You add a diagnosis by searching for the appropriate ICD-10 code and specifying the onset date and type of condition to keep the patient's records accurate and up to date. You return to the patient portal to review your updated health records. You check the latest lab results, review the active prescriptions, and select your preferred pharmacy and lab for the pending orders to complete your care plan for the week. You access the My Team section in the Provider Hub to manage staff roles and assign responsibilities within your clinic. You review your weekly schedule to manage upcoming appointments and ensure your availability is correctly set for patients. You use the secure messaging feature to compose a new message. You select the patient, enter a subject, and type a detailed note about their medication and delivery expectations before sending it securely to their portal. You ensure the instructions are clear and provide contact information for any follow-up questions to maintain high-quality patient care and communication.